Welcome back to continue our discussion talking about sexually transmitted diseases. Joining me again here at Morton Health Center is Dr. Michael Opong-Kusi, Medical Director. Let's jump right in. In our first segment, we talked about sort of the increasing incidence of sexually transmitted diseases, especially among that 14 to 30 year category, year of age. And then we talked about the wrapping issue in terms of what's on the outside may not tell you what's wrapped up on the inside. So let's look at chlamydia as one of the sexually transmitted diseases. Tell us what it is, how does one get it, who does it affect, and then we're going to look at treatment.
Okay. I think all sexually transmitted diseases obviously are transmitted primarily through unprotected sex.
Okay.
Chlamydia is one of those diseases where most people, especially men, will not have any symptoms. So again, talking about a wrapping issue is very deceptive because they may be completely without symptoms or asymptomatic. Most women also, when they have chlamydia, will not have any symptoms. And interestingly, chlamydia is the most common sexually transmitted diseases for the mere fact that there is not an easy symptom that a patient sees.
Okay.
And because of that, most people will infect their partner sexually without knowing they even had any sexually transmitted disease. Interestingly, most of the time we diagnose chlamydia when we are testing for other sexually transmitted diseases.
Okay, so is there any point in which a person would have symptoms? Maybe if they've had this disease for 3 months or 4 months, does there tend to be sort of any secretions like, you know, mucoid type secretions or greenish or yellow secretions that show up in the underwear, or any burning up on your neck? I mean, is there anything that does end up appearing?
Nothing really overt or anything that you can see. What we find, though, interestingly, is that most of the time chlamydia is present with other infections. For example, generally when we screen people for, say, gonorrhea, and in gonorrhea you have a distinctive discharge. You know, most people will feel also pain when they urinate or burning. And interestingly, when we are testing for gonorrhea, we simultaneously test for chlamydia. That's when we will find that most patients are infected, you know, with chlamydia. Most men, again, if they have only chlamydia, will be totally asymptomatic. They will not have any symptoms at all. They may experience some discomfort on urinating, but they may probably brush it aside.
Okay, so starting to pick up on some minor discomforts in this area could be very important, especially among men, in order to go in and be tested. Let me ask this question then, because people may feel this is a kind of frightening concept that you may not have any symptoms, and only if you get another transmitted disease, sexually transmitted disease, or something else that you go in to be tested for, is this picked up. What can it lead to if it's untreated? I mean, is this one of the sexually transmitted diseases where you can end up with sterility or other kinds of issues?
Yes, chlamydia, especially among women, can lead to premature births because of the effect that the chlamydia have on a woman's cervix, which we use medical jargon, the cervix becomes incompetent.
Okay.
Also, again, women are at risk if you have repeated sexually transmitted infections. It can scar your uterus and also the fallopian tubes, and also causes sterility if it's not treated.
Okay.
And so that's what makes chlamydia especially so difficult both to detect and also the long-term implications.
Okay, now let me ask this question, a couple questions. In terms of detecting it, does it have to be for women by a pelvic exam or other for men, or is there a blood test that you can do to pick it up?
Really interestingly now, we have a urine screening which can test for chlamydia.
Okay.
So hopefully that will be painless for most patients.
Right.
But generally we recommend, especially again, both male and female, that if you have any suspected sexually transmitted disease, that you need a full pelvic genital exam, where cultures can be taken, and also these cultures then grown in the lab to definitively diagnose, you know, the kind of organism you have. Because again, as I said, you may have not only chlamydia but gonorrhea and a whole host of other sexually transmitted diseases.
Now, is this a condition that, once it's detected, is easily treated, or is it difficult to treat?
It is easily treated. We have very good treatments for chlamydia, and we also have very good. 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 We also 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 very good. And 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 we also very good. Once people. And we also very good. 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 And we also